The 2014 viral Ebola, the COVID-19 pandemic, and the spread of other large-scale disease have shown that infectious disease outbreak can have devastating impacts on any society. Yet, many African countries lack the capacity to manage these threats. It is the 8th edition of African Conference on One Health and Biosecurity, and discussions of health experts from 20 countries are centered on mitigating biological threats in Africa.
Collaborating with other stakeholders in prevention, in detecting and mitigating generally against infections. Like we know, health security is everyone's business, and the Nigerian police force is training personnel in areas of capacity building. Because when officers trained, when we went for police trainings, we were not trained based on biological threats. But now times have changed. So when we're training our officers in the colleges, in the institutions, we train them based on biosecurity and biosafety so that they are armed and they are able to respond in a case of biological threats.
I think they are to carry out more sensitization program in order to mitigate these pandemics. If you don't have safety or a healthy environment, you will not have healthy people in it.
Host and Lagos State Commissioner for Health, Professor Akin Abayomi, says due to the peculiar nature of Lagos and its vulnerability to diseases, the state is building strong resistance for future outbreak.
That success was as a result of a lot of hard work over 5 years after Ebola, preparing for another pandemic. And even now that we have brought COVID under control, we're looking into the future. And Mr. Governor has a very elaborate plan for biosecurity control. We're trying to develop Lagos as the model megacity, and therefore we cannot be building all this infrastructure and not pay attention to ensuring that it is protected from biological shocks.
And for us to effectively mitigate these threats that is facing us in the world today, especially in Africa, there is need for us to organize conferences like this, to bring experts from different countries, from different disciplines to come together to see how we can find African-led solutions to this problem that is ravaging us in Africa.
Experts concluded that a One Health approach, which is collaborative and multi-sectional, will hasten optimal health outcome and address potential existing risks. In Lagos, Adobe Obiechina, NTA News.